Hi, everyone. Welcome tonight to our very special call with Registered Dietitian Kristin Finley. She and I have been teammates for over 8 years at this point, and I've always been really impressed with the data, the information that she presents that compels people to really take a look at their health and focusing on their health with more intention. And I'll start today. This call will be around 35 minutes or so before any Q&A. So we hope you'll stick around till the end. But I'll start by saying that for 20 years, I've been a proud partner of the Juice Plus company. And I'm deeply committed to helping people experience the powerful impact of putting more plants in their bodies. And along the way, I became a master certified health coach, and I also founded the Joy of Wealth, WELLTH, a health coaching company grounded in the belief that the quality of your health is the true measure of your success. My journey with Juice Plus began when my children were in elementary school and catching everything. My husband and I were busy professionals with little time or energy to make nutritious meals for our family. I'm so glad I was open when someone approached me and asked me to take a look at Juice Plus, as it changed the health of my family for the better. Our kids never had another earache and didn't catch colds as easily anymore. My energy, which was always in a slump in the afternoon, has completely turned around. I've had off the chart energy for the last 20 years. My borderline anemia was improved to normal levels. I had virtually no menopausal symptoms. My husband's inflammation was reduced to eliminate his back pain. And overall, we feel as if we're aging more gracefully in our late 50s. So I do want to acknowledge that this is my personal experience with Juice Plus, and everyone's journey is unique. And while results may vary, what's consistent is the science. And that's why I'm so excited today to be joined by registered dietitian Kristin Finley. Kristen will share the clinical research and the real data that proves Juice Plus gets into the body and does truly beneficial things for anyone who takes it consistently. So who is Kristin Finley? Kristen is a registered dietitian and a certified personal trainer who's based in Tucson, Arizona. Kristin's originally from Boise, Idaho. She attended Oregon State University, where she competed as a Division I gymnast on their nationally ranked team. After earning her degree in dietetics, Kristen completed her dietetic internship at Barnes Hospital in St. Louis, Missouri, and she went on to work in clinical nutrition for over a decade. She then took a meaningful break from her professional career to raise her three sons. We both have three sons, with her husband, Charlie, a U.S. Air Force pilot. The journey took them across the country, eventually landing at Davis-Monthan Air Force Base in Tucson in 2012. And when Charlie retired from active duty in 2017, they chose to make Tucson their forever home. So Kristen launched Daily Dose Fitness and Nutrition. She combined her passion for evidence-based wellness with practical coaching. She also partnered with the Juice Plus company to offer whole food solutions to those ready to reclaim their health, their energy, and their vitality. So with that, I introduce you to Kristin Finley.
Well, hello, thank you. I'm just a step behind because I had a little bit of an issue here, but I think I'm good. So anyway, here we go. Good evening, and thanks, Caprice, for the introduction. So I am super excited to be here tonight to speak about a health journey that has changed my life, my family's life, as well as the lives of so many others that I love and care about. It's a journey that I think is doable for anybody at any stage of life. And as a dietitian, I'm super passionate about it. I'm assuming you're here tonight because you're hoping to gain some nugget of information that you can put to use tomorrow morning, something that will motivate you to take the step to increase more than your lifespan. Because let's face it, a long life is not that great if we're not living well. What I'm really hoping to inspire is action that will improve your health span. So my hope is that I can leave you with a clear path for the next step in your health journey, I'm going to start by looking at some US health statistics, and then I'll examine steps that you might take to begin your journey. But my first question for you is, why do we even need a health journey? And I know this is a personal question and everyone has their own reason, but I want to share a few statistics that might bring your personal reason into focus. So chronic illness and chronic disease is something that I'm sure all of us have some connection to, whether you are affected by it or you know of someone who is affected. In fact, 6 in 10 people have one chronic disease, and 4 in 10 have 2 or more chronic diseases. And chronic disease is any condition that's lasting longer than a year. And although you can see it's very prevalent, I'm here to tell you it is not normal. What you may not know is that chronic disease is the leading cause of death and disability in our country. The most prevalent chronic diseases in our country are heart disease. It's the leading cause of death, followed by cancer, which is the second leading cause of death. Diabetes affects more than 37 million people, and 20% don't even know they have it. Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that includes asthma and bronchitis. Stroke, a sudden loss of brain function due to a blockage or burst blood vessel in the brain. Alzheimer's disease, a progressive brain disorder that causes memory loss and other cognitive memory or other cognitive issues. It affects 9% of the population over 65 years old, and kind of a staggering 1/3 of the population over 85 years old. Chronic kidney disease is a condition that damages the kidneys and the ability to filter waste from the blood. So those are a few of the biggies. There's lots of chronic diseases, and just to name a few, some others include autoimmune disease, inflammatory bowel syndrome, hypertension or high blood pressure, arthritis, a condition that causes stiffness and pain in the joints, and obesity, which is a major risk factor for many other diseases. This is not a complete list, but think for a moment of either yourself or somebody that you know that has one of these conditions. Chronic disease not only causes death and disability, but it steals our joy and robs us of our hopes and dreams, because if we're sick, the only thing that we really can dream about is being well. So chronic disease is also not cheap. As you can see by this slide, the US spends about twice as much on healthcare as other large, wealthy countries. And you would think, with the amount of money we spend, that we would at least rank high with our other countries' health outcomes, but that is far from the truth. In fact, the United States has the poorest health outcomes when compared to other large countries. So in our country, we tend to use medications as a first line of treatment for most medical problems. Polypharmacy, that's the use of at least 5 medications at the same time, affects 37% of the general population and 65% of those that are 65 and older. And what's the problem with polypharmacy? There are many complications. So one is increased potential for taking medications incorrectly. So some medications need to be taken with food, some without food, some need to be taken alone. And the more medications you get with these specific instructions, the more difficult it gets to really be taking everything correctly. Also, we have drug-drug interactions. So some drugs make other drugs not as effective, and some drugs make other drugs too potent. So it can go either way. Drug disease interactions. For example, some drugs cause high blood sugar. And so what happens then is you need to add more medication to lower the blood sugar just because of the effects that the drug had. Cognitive impairment increases as the number of medications increases, and with that cognitive impairment, or independent of the cognitive impairment, we see increases in falls, hospitalizations, and prescribing errors. Prescribing errors gets particularly tricky when we have multiple doctors prescribing multiple medications. So if we're not talking about medications, how are we going to treat chronic disease? There is definitely a role, and I don't want to poo-poo the role that we have for our health providers and even medicine. There is a role for that. But we cannot use those tools to lessen the role that we play in our own health. Our healthcare system is becoming more and more taxed, and we are becoming a society that is increasingly focused on sick care versus well care. So it's not only good practice to practice healthy habits, but it is becoming vital that we do so if we want to prevent chronic illness and chronic disease. And if we want to increase our lifespan, but more importantly, if we want to increase our health span. And there are 6 habits that I like to look at that have a huge impact on our health span. The first 3 habits are ones that we should work to increase, and starting with nutrition, where according to the CDC, 90% of us, I'll repeat that for the people in the back, 90% of us are not eating the recommended number of servings of fruits and vegetables. And 42% of us are considered obese. 80% of Americans are not exercising regularly, and 35% of Americans are getting less than 7 hours of sleep a night. And poor sleep is not only linked to chronic health problems like hypertension, heart attack, and stroke, it also affects appetite hormones that increase hunger and calorie consumption. Obesity is markedly increased for those who get less than 7 hours of sleep. Now for 3 habits that we should work to decrease or eliminate. Chronic stress has a significant effect on the immune system that ultimately manifests in illness. It raises catecholamine and suppressor T cell levels, which suppress the immune system. In 2022, 19.8% reported tobacco product use, with 11.6% reporting current cigarette smoking. So the good news is these numbers are decreasing, but we still have more than 28 million smokers in our country, and this is one of the biggest preventable chronic illnesses, or one of the biggest preventable causes for chronic illness in our country. 1 in 3 adults is an excessive drinker. And that means more than 8 drinks a week for women and more than 15 drinks a week for men. And most of those who are excessive drinkers at least have some binge drinking, which means they're consuming more than 4 drinks in on one occasion for women and 5 for men. And 1 in 30 adults is classified as alcohol dependent. The CDC estimates that eliminating 3 risk factors, poor diet, inactivity, and smoking, would prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer. And I understand that this may be a bit optimistic, as eliminating these risk factors may be a bit idealistic. But just imagine if we could even make a dent in reducing or affecting some of these changes through our habits. And since I'm a dietitian, I'm going to spend most of the rest of the time talking about what a healthy diet can do, which brings me to this little girl right here. She's 6 years old. She has a twin sister that was wearing the same outfit and looked absolutely perfect in her picture. My parents weren't quite sure what happened here with the crooked smile, and there's actually a booger in my nose. But anyway, I digress. This little girl was smart. She was athletic. She was seemingly well-nourished, healthy child who at the age of 6 was diagnosed with her first chronic disease, an autoimmune disease called psoriasis. And although psoriasis may seem benign, it's painful, it's embarrassing, and it increases the risk of obesity, depression, diabetes, hypertension, and heart disease. In addition, it comes with projected shorter lifespan. So this girl would take medications every day for the next 43 years in a poor attempt to manage her symptoms. The young woman in the middle was a Division I gymnast who was healthy and strong in addition to being an honor student with the highest team GPA. She also had 5 surgeries in her 4 years at college. She had chronic back pain, ankle pain, shin splints, and stress fractures. She ate Motrin like candy, and with that, along with a less than ideal diet, she developed anemia. In addition, her psoriasis was horrible, and she would go on to develop a pretty severe depression. And finally, the grown woman on the right is involved in triathlons and was in great physical shape despite being in perimenopause and approaching 50. What you don't see are the 3 allergy medications that she has started taking along with those psoriasis medications. She has chronic back pain due to all those college endeavors, and she's due to all the surgery that she's had, she's facing a knee replacement. Throughout this journey, this girl, this collegiate athlete, and this middle-aged woman was offered lots of medications and lots of surgeries. A lot of it was necessary, but at no time did one doctor offer hope with nutrition and lifestyle. If I think about this, it's not that unbelievable, as I know that most doctors receive very little nutrition education in their training, and most of the nutrition education that they do receive is focused on specific guidelines for disease states, like how many carbohydrates should a person with diabetes have for breakfast, or how much protein should a patient have that's in end-stage renal disease. And even as a clinical dietitian, nutrition to improve health span was undervalued. We were more concerned with getting people healthy enough to leave the hospital, and very rarely saw patients after discharge, even when we recommended outpatient follow-up. I am of the belief now that regardless of the healthcare system that has many knowledgeable doctors and that can extend our lifespan, extending our health span is largely our own responsibility. We are going to have to make the time to become educated, the time to do the work it requires, like making healthy meals or doing daily exercise. And we're going to have to make some financial investments as well, whether that means a gym membership or spending more at the grocery store to ensure we have plenty of produce. But as someone who has counseled a lot of clients, a lot of people, these investments are so much better than the investments required when one is dealing with one or more chronic illnesses. So where do we start as we decide to make a lifestyle change? Many people start with exercise. And as a personal trainer, I think this is great. We need to move our bodies more. I think my statistic was that 80% of us aren't getting enough exercise. And particularly as we get older, we need to be incorporating strength training into our exercise plan. As a dietitian, however, I believe we can't ignore the idea that fruits and vegetables truly are the foundation of good health. And to improve our long-term health and our health span, we must work to improve the statistic that 90% of us are not getting enough. Why? Because the nutrition in fruits and vegetables decrease chronic inflammation, and inflammation is the root cause of nearly every single chronic disease. Fruits and vegetables give the liver the nutrition it needs to get rid of toxins, and when the body's toxic load is decreased, inflammation is decreased. Fruits and vegetables also decrease oxidative stress. Think of your body as a machine equipped with an internal campfire. And as our body turns food into energy, it keeps that campfire running and provides us with the energy we need to live. Just like a wood-burning campfire, however, our internal campfire creates smoke and embers. And in our body, we call these things free radicals. You've probably heard that term. But free radicals are oxygen-containing molecules with an uneven number of electrons. As these unstable molecules bump into tissues and cells, they damage fatty tissue, DNA, and protein and cause inflammation, which is the precursor to chronic disease. Fruits and vegetables contain antioxidants, which donate an electron to these unstable molecules without becoming unstable themselves. The fiber in fruits and vegetables provides food for the good bacteria in your gut. And we are learning so much about the microbiome, and it's a whole other talk. So I'm not going to go into it too much here, but the more good bacteria you have in your gut, the healthier you're going to be. And finally, fruits and vegetables support a healthy weight. And because weight loss is a part of so many people's plan to improve their health span, I want to spend just a few minutes talking about how fruits and vegetables assist in weight loss. Part of weight management and weight loss depends on the toxic load in our body. So toxins are everywhere. They're in the air, the water, the soil, plastics, household cleaners, and the products we put on and in our body. Toxins are primarily fat soluble. And to get them out of the body, they have to be converted to a water soluble form. Fruits and vegetables provide the substances for this to happen. So if you lose weight by burning calories through diet and exercise, but lack an intake of fruits and vegetables, then you are not going to be able to convert, to make that conversion, and the fat soluble, the weight will go away, but the fat soluble toxin or the toxins will still be floating around in your body. This is shown in the top part of the slide. So those remaining toxins not only contribute to inflammation when they run rogue in the body without the protection of the fat provides, but they also seek fat to wrap themselves back up in, resulting in rebound weight gain. The scenario in the bottom part of the slide is different in that this person may be using diet and exercise to lose that weight, but is also supporting those efforts with plenty of fruits and vegetables, which allows the conversion of the fat-soluble toxins to a water-soluble form where they can be excreted from the body, so that there's no need for the body to go on that fat-seeking mission. It's a much more effective way to get rid of fat and keep it off. So I guess the next question is just, well, how much is enough? How much do we need? I hope you're now at least seeing that we can do a lot of good by just eating more fruits and vegetables. And it sounds so easy. Like we just need more fruits and vegetables, like 7 to 13 servings every single day. But I have been a dietitian for 35 years, and 35 years later, I'm still telling people we need to eat more fruits and vegetables. But like I said earlier, 90% of us are still not doing it. I'm included in that on some days. Some days I'm on it, some days not so much. And what we are getting is not as nutritious as it was 50 years ago. And this is due to a lot of factors. It's including depletion of our soil, produce being harvested before it reaches its peak ripeness when the nutritional value is maximized, and shipping produce thousands of miles before it's sold. When I first started working as a dietitian, we were telling people to eat 5 a day. And it's now thought that someone in good health with no chronic health conditions needs about 7 servings of fruits and vegetables a day. But someone with a chronic health condition or athletes may need as many as 13 servings or even more. So why is this? Well, illness and activity increase inflammation and oxidative stress. More oxidative stress requires more antioxidants to neutralize the free radicals, and the foods highest in antioxidants are, say it with me, fruits and vegetables. So think about how many servings you've had today. I'm just going to pause. Like, how many servings of fruits and veggies have you had today? Are you close? It's also worth mentioning that it's not enough to just get the proper amount of servings, but each fruit and vegetable has a unique set of chemicals called phytonutrients or phytochemicals, and we need a wide variety of fruits and vegetables to get as many different phytonutrients in our bodies as possible, because those little chemicals are needed to keep the body running smoothly. So it really is important to eat the rainbow. In 2015, I was introduced to something that changed the way I thought about my and my family's health, as well as the way I practiced dietetics. I was introduced to a product called Juice Plus, which is basically dried fruits and vegetables that come in a capsule, a chewable, or a drinkable form. And when I say fruits and vegetables, I don't just mean the juice. I'm talking about the whole produce with the peels, with the peels and seeds whenever possible. I'm talking about acerola cherry, dates, cabbage, spinach, kale, bilberry, blackcurrant, and cranberry nutrition in your body every single day. I don't know about you, but I've eaten a bilberry never, and I eat cranberries about once a year on Thanksgiving. They usually have a lot of sugar in. They're cooked up with a lot of sugar, but I get that nutrition in my body every day by taking these Juice Plus capsules, chewables, or the powder that is made into a drink. Juice Plus is not a vitamin mineral supplement. It is functional food. It's made from non-GMO produce that is mashed up and put into a slurry and then dried at a really low temperature to preserve the nutrition. The powders that result, like I said before, are either encapsulated, put into chewables, or made into a powder that can be added to water for, I might add a very delicious drink. I'm really loving the superfoods powder. I love that the product is NSF certified, meaning it's third-party tested for purity. But most of all, I do believe in science. Because I do believe in science, I love that it is researched. Over 40 clinical studies have been published in peer-reviewed journals showing that it builds our body and conditions our physiology at the cellular level. So I love that. One of my favorite studies was done in 2017. It looked at polyphenols. Polyphenols are plant nutrients. I've said the word before, phytochemicals or phytonutrients that have beneficial effects on the cardiovascular health and oxidative stress. This was a one-day trial, and it was done on 20 subjects who, for 2 weeks before the trial, avoided any supplements, dietetic products, drugs, or medicines, and 2 days before the trial went on a low polyphenol diet so that their bodies would not have free-floating polyphenols in them. So on the day of the trial, they first all had a baseline blood draw done, and then they were given 1 fruit, 1 vegetable, and 1 berry capsule. That's a half of the adult dose. And then it was followed by blood tests that were done at 1 hour, 2 hours, 5 hours, and 10 hours. And the researchers were able to find 20 polyphenols that were in the Juice Plus in the blood samples at different times, suggesting that some of the polyphenols were absorbed in the small intestine and some in the lower part of the intestinal tract. But the really interesting thing is that there were polyphenols that aren't even in Juice Plus that started showing up, suggesting that the body converted the polyphenols from Juice Plus into new polyphenols. And it is also suggested that the polyphenols from Juice Plus help to nourish the microbiome, which we have learned so much about, very important. So I really like that study, and it is up here on the slide. Was published in Nutrients in 2017, done in Parma, Italy, and the Medical University of Graz in Austria. So in 2015, I became my first client. And after a year of consistently taking it, I couldn't deny that my experience mirrored the research on the product. So I became a partner with the company, as I knew this would be something that I could offer my clients who I know 90% of them were not getting enough fruits and vegetables. And I can tell you, I've had hundreds of clients over the years, and I have yet to meet one that is like spot on their fruits and vegetables. The fruit and vegetable and berry essentials are our signature product at Juice Plus, but I want to mention some other amazing products very briefly. So the Omega Blend Essentials are unique from other omega supplements because they're plant-based. Instead of containing fish oil, they contain algae oil, algal oil. So we bypass the fish. And instead of just containing omega-3 fatty acids, they contain the whole spectrum, the 3, 5, 6, 7, and 9, which I love. Another awesome thing to me is that the vegan capsules are cold fused. And this is kind of important because a lot of omega capsules are heat fused, and that heat oxidizes the oils. Those oils are pretty sensitive in there, the omega oils, and it sort of denatures them and makes them not as effective. So I like that the 41st Juice Plus study was done on the omegas in 2020 and showed they increased the omega index, which is significant because a higher omega index is associated with a reduced risk of cardiovascular disease, improved cognitive function, and maintenance of normal vision. Juice Plus has two plant-based protein powders. Both are vegan. Complete has 13 grams of protein and 8 grams of fiber. And I love that it has this fiber in it because it helps to stabilize blood sugars and it provides food for the good bacteria in the gut. That's called a prebiotic. The Perform is our newer protein powder, and it has 25 grams of protein per serving and also ingredients to support performance and recovery. I like the trial that was published in Gynecologic Oncology that studied whether Juice Plus could bridge the gap between what cancer survivors should and actually eat. So they had 51 stage 2 to stage 4 ovarian cancer survivors. They randomized them into 2 groups, and one group followed the Women's Healthy Eating and Living study diet, which included eating 10 servings of fruits and vegetables per day. The second group ate 5 servings of fruits and vegetables per day, but they also took the fruit and vegetable Juice Plus capsules and a complete shake every day. Both groups showed increased levels of antioxidants, such as beta-carotene. Both had stabilized key markers of cancer, and both reported having a good quality of life. The interesting thing is that the Juice Plus Complete group had better protein status and better compliance. I mean, let's face it, it's hard to eat 10 servings of fruits and vegetables every day. So I think that that was a really great study. That one was done at the University of Texas and MD Anderson. And finally, I want to put the spotlight on one of the newest products in the Juice Plus lineup, Luminate. It's a low sugar, gluten-free, powerful blend of plant-based nootropics and adaptogens. And if you're saying, well, what are those? I'm just going to say, simply put, adaptogens are used to ease the effects of stress on the body, while nootropics are used to stimulate cognitive function. Because this is a new product, we are relying on studies done on the ingredients versus the actual product here, but people are reporting enhanced mental clarity, increased mental energy, heightened alertness, improved working memory, and better focus and concentration in as little as 30 minutes after taking this product. This has been a new one for me too. I've just started being more consistent with this one, and I'm really liking it. And I messed up. I was gonna adjust this slide a little bit. It's a little bit off, but our company this month, for the whole month of May, is doing a little special where if you order the fruit, the vegetable, and the berry capsules, you get 2 boxes of Luminate, which is 30 servings, and a bag, either chocolate or vanilla, of Complete, which is 15 servings and $127 value. So I think that is really awesome. If that is something that you're interested in down the line, get with the person that invited you to this talk and they can get you started. All right, so, and whatever happened to this little girl, right? The little girl diagnosed with an autoimmune condition at age 6. The little girl who ate fruits and vegetables as a kid. Thank you, Mom. We always had a vegetable always had fruits and vegetables at our meals. The little girl who went on to compete at a at a ranked Division I gymnastics team, despite a lot of injuries, and a little girl who went on to be a registered dietitian that ate lots of fruits and vegetables, maintained an active lifestyle despite pain and allergies, along with that nagging psoriasis. That little girl turns 58 this month, and she, a few years ago, sat in a talk very similar to this and thought, what if? And so she started with one simple change of a few capsules a day and eventually changed other lifestyle habits to improve her health span. She made exercise an almost daily activity, and she began to prioritize sleep. That little girl went 43 years without missing a day of psoriasis medication, now uses a fraction of the medication she once did. She no longer takes any allergy medication. That little girl had a knee replacement in 2021 and biked 20 miles 8 weeks later and skied 6 months later. That, I guess, not a little girl anymore, but that little girl feels better in her 50s than she did in her 30s and 40s. So my question to you is, I want to ask, what does improving your health span look like? And like I told you in the beginning, it's going to be different for everybody. But for me, it's the ability to spend quality time with my people who are all here, my 3 boys, my husband. It's the ability to hop in a water taxi and explore the cobblestone streets of Burano, Italy, to walk across the Brooklyn Bridge and all over New York City, to bike the streets of Belgium, to explore castles in Lisbon, and to zip line over a rainforest in Costa Rica. I'm here to tell you it has not been at no cost. I've spent money, I've invested time, and I've made some sacrifices to support my health. But I look at these pics as an almost 60-year-old, and I know that most of this would be impossible without my health. I want to leave you with a couple of slides. I debated whether to put this one up because as a dietitian, I really don't believe in labeling food as good or bad. Ultimately, I do believe that all food can fit into a healthy lifestyle. But what I want you to think about, and I want to emphasize, is that you are able to affect your health with the choices that you make. I also want to emphasize that it's not only a good thing to be your own health advocate, it is vital that you are your own health advocate because no one is going to care about your health as much as you do. And so in closing, I just want to say a health journey is a marathon. It's not a sprint. I would rather see people make one change that they can do most of the time forever than to make 10 changes that last 1 month, 2 months, or 6 months, even a year. Because ultimately, these short-term changes, and really a year in a lifetime is a short-term change, it's not going to really impact your life. It's not going to really impact your health span. But I challenge you to take a step, whether it be exercising more, getting enough sleep, eating more fruits and vegetables, or committing to adding a product like Juice Plus to your daily diet. And with that, I'm going to stop my screen share and I am going to send it right back over to Caprice.
Wow. What do you all think? I mean, just wow. I told you at the beginning that, Kristen, in her 35 years of experience and just her passion and how she cares about people, it completely shined in this presentation. And I I feel so empowered. We started the presentation with, the state of affairs and health in America, and we ended, I feel joy, and I feel empowered about what tools that I have, that we have to turn the tide on health. So in closing, I want to leave you with 3 simple options. You can act on these options because no matter where you are in your journey, there is something here for you. So the first one is that maybe today simply inspired you to be more intentional about your health. And that's a win. Take that inspiration, make some healthy changes to your routine, and your body will thank you. The second choice is maybe you're curious and you're ready to experience Juice Plus for yourself. It's an easy way, as Kristen described, to bridge the gap and get optimal nutrition every single day. And if that feels right to you, connect with the Juice Plus partner who invited you to this call, who will gladly help you get started. And be sure to ask about this month's special so you get the best bang for your buck. The third option is maybe someone came to mind, a friend, a child, a loved one who could use more health, more energy, more vitality. If you feel called to pay it forward, the partner who invited you to this call can show you how to do that too, which can even bring in extra income for you. So, whatever the next step is for you, we hope you don't leave here the same. Take action that supports the health and the future you want for yourself and for the people you care about. Please act. It's an acronym, ACT. Act on what you heard tonight because action changes things for you and for the people you care about. Thank you for joining us today. We'll go ahead and open it up for questions if you'd like to stay and have any for Kristen. And thank you, Kristen, for blessing us with such an incredible presentation.